I was due to get vaccinated for HPV, meningitis or tetanus, but immunization services have been disrupted. Should I be concerned?
WHO recommends that countries continue routine immunization services wherever feasible. For example, school-based vaccination initiatives should continue only if infection prevention and control measures are implemented to avoid increased risk of transmission of the COVID-19 virus among the students, school personnel and healthcare providers. However, vaccines provided to adolescents have sufficiently flexible schedules to make sure you can get the vaccine in time when vaccination services start again. For example, the HPV vaccine that requires 2 doses can be started anytime between 9 and 14 years of age, and the interval between the 2 doses can be longer. The minimum interval between doses is 6 months, but it can be 12 or 15 months and, if necessary, even longer. It is most important that you receive the second dose at some point in time to be fully protected. Decisions to continue routine vaccination services are made by each country. Ask a family member or another trusted adult how you can get information about vaccination services where you live. It is important you get the vaccines you are supposed to get, even if they have to be delayed due to the COVID-19 pandemic.
I am on medication for a chronic health condition. Should I change anything?
For people with chronic conditions such as asthma, diabetes, terabytes and HIV, the most important thing is to continue your medication as prescribed, attend recommended checkups, and seek medical help if you have new symptoms.
Check with your health authorities and health provider if your regular checkups should be done differently during the COVID-19 pandemic. Some services, such as counseling, may be available remotely. For treatment of clinically stable adolescents with HIV and adolescents with terabytes and/or other chronic conditions, your health provider should consider multi-month prescriptions and dispensing, which will reduce the frequency of your visits to the clinic and ensure continuity of treatment if movements are disrupted during the pandemic. Seek advice from your health authorities and healthcare provider on how to be protected from COVID-19 and continue your treatment as prescribed.
I am bored having to spend so much time at home. Since I am very unlikely to get severely ill even if I was to get COVID-19, why is it important that I follow the guidelines to prevent transmission, such as keeping physical distance from other people?
Spending more time at home is difficult and can get boring, but it may help to do something you enjoy. This could be reading a book, playing games, or listening to music. Try to stay connected with friends and family every day, either by communicating with them by phone or internet if you can, or, if you live close to them and the local rules allow you to, by talking in person while keeping your distance. You can also get involved with your community to help fight the transmission of the virus. At the same time, it is still really important that you reduce your chances of being infected or spreading COVID-19 by washing your hands with soap and water or alcohol-based hand rub as often as possible, keeping at least 1 meter (3 feet) from other people, and avoiding crowded places. Even if adolescents with COVID-19 usually do not have symptoms and have mild disease, you might be one of the unlucky adolescents who does get severely ill from COVID-19, or you could spread it to others and be responsible for them getting really ill or even dying. You have the power to make choices that could save lives, and together young people can play an important part in fighting COVID-19.
Some of my friends are not sticking to the rules about physical distancing. What should I do?
Explain to your friends why it is important to protect themselves and others by washing their hands, avoiding touching their face, always coughing or sneezing into their elbow, sleeve, or a tissue, and cooperating with physical distancing measures and movement restrictions when called on to do so. Maybe you can share ideas for fun virtual activities that your friends can participate in, and you can encourage them to do them together with you or with other friends. For example, you can encourage them to join Youth Against COVID-19 campaign that aims to help teach young people around the world about COVID-19 and what they can do to keep their friends, families, and communities safe. This way you are giving them alternatives rather than just telling them to stay at home. But remember that you do not have control over other people's actions, so do not get into an argument or a fight to try to change their minds.
Goodbye in the third episode of Coronavirus Disease, COVID-19,